Okay, now get that free book. Because I don't know how long we're going to keep offering that for free, so it may go away quickly. But now let's talk about healthcare. You know, there's a new Obamacare out there. If you haven't heard about it, you know, if you're living in a cave somewhere and you don't know it's coming, and it's coming like in, you know, what is today? May, so about 6 months. It's going to be here in full force, but it's already here. People don't realize that, and what we hear on the news about it, are people trying to scare the pants off of you. Half the people don't like it, things like that, and to me it's all stupid. It's going to be here, something's going to happen, and yeah, I don't like it either, you know, because it deals with the existing system. That's why I can't understand these people are so upset because they're changing the healthcare system. No, they're not. It's the same bloody system. You know, the medical people and, you know, all the health cares are all going to get money, you know, the same money and more than they had before because the government's now going to pay for it. So, I mean, it's stupid, but this is reality. So what you have to know as a consumer is what's available for you. You want to fight the system, that's separate. You know, but getting health care is very important. So you have to know what's going on. And really, for everybody out there, to tell you the truth, it's a win. But who's losing? Probably the taxpayers, because it's going to cost us more. You know, but that's another question. What you want to know is get covered health care, you know, and how to do it. Well, the important thing is that it goes up to $94,000, and the government will give you money to help you pay for health care. $94,000. That's right. And more people will be covered 100%. You know, by health care, and that's important. So the subsidy is important, you know, getting you health care is important, and that's what it'll do. You know, so all the other scare stuff, I mean, yeah, maybe that's right. Maybe, there's a better way to do it. I certainly think so. But this is reality. More people are going to be covered. Okay, so you got to find out about it. And look at this data. You know, 72% of the people making from $0 to $94,000 don't know about their options under the new insurance plan for Obamacare. They have no idea. That's 72% of the people have no idea what the hell's in this plan. So how could you be complaining? Yeah. Oh, yeah. But more importantly, that 72% has to start learning. You got to know, because this is going to come, and there's other good things about it, because you don't have to deal with salesmen anymore, you know, and that's important. So 72% don't know about the plan. But before we get into the salesman part, let me show you another interesting thing about the new program that's in effect now. That's why you don't have to wait till January. Right now, you're covered. If you have any kind of health care plan now, a current plan with anybody, you know, your employee, yourself, Medicare, Medicaid, anything, any plan at all, you're covered, anything. All preventive services are free, 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 free. So if you want to lose weight, that's a preventive service, see? Because if you're overweight and you want to lose that weight so you don't get sick, right? So that's a preventive care. You could get weight loss programs for free under the Obamacare, this so-called Obamacare. Depression, you're suffering depression and want to get treated. That's that is available free under the new health. Smoking, you want to quit smoking, that's available for you. Actually, there's other programs that offer it for free in a lot of states too. Alcohol abuse, your treatment recovery, any of these kinds of things, any kind of preventive care. You want to go for a physical, a full wellness physical. Hey doc, every week I want to come in and get checked to make sure I can run that triathlon tomorrow. Free. They can't charge a nickel, copay, nothing. You pay, I pay, nobody pays, you know? It has to be covered. So that's, I think, very important. You go in and get a cholesterol check right now. You know, you get any kind of checkup, you know, that you want, any kind of test. All those are free under the new plan. So that's important to know. I mean, your family should know about that. You have to tell anybody. You have seniors or whatever. You know, because they don't want to do the copay, even if it's $30, $40. No, they can't do that. So get your butt out there and see somebody and help yourself, help your family and stuff like that. Here, under that, and you know, because of that, over 80 million people in this country are now eligible to take advantage of this free, 100% free preventive care. The law requires that current health care plans offer free preventive care, even if your plan did not do so earlier. There are no incidental amount of free preventive service, incremental amount of fee, free preventive service. So they can't charge a nickel, to do any of those things. Now, another thing that's going to happen in the Obamacare that you should start getting educated about is these the health care, gosh, what do you call those things? Remember, Smiley?
Yeah.
What are the health cooperatives? What are the state what? Exchanges, that's it. Why can't I? Getting old, I forget everything. Healthcare exchanges. Every state's going to have one. There's a couple states that, oh, we're not going to do this. And, well, then even if they don't, the government's going to have one. And they sound great, because now it's a place. It's going to be like Consumer Reports for healthcare. You go to one place. All the plans are equal, so you won't have some salesman come, hey, all those other plans are full of crap, and you better buy mine or else you'll die. That's how salesmen operate. You go to these places, and they have them all categorized, what's that? And they have people who evaluate them all that will help you decide. So these people aren't selling you anything. They're making an independent decision to help you get the best plan. See, salesmen, you can't trust a salesman. I mean, sure, a lot of them are honest and all this stuff, but their motives are different. They have to sell, and it's very difficult for them to be objective, and so you can't put them in that position. Don't bother. Find an independent source. So evaluate it first. You want to try salesman later? Yeah, but get an independent source, and that's what this is. So it's a place you call. Every state's going to have an independent source to evaluate all the plans, help you decide. So these are free experts. Just like there's free experts now to help you with your credit problems, and free experts to help you start a business. See, and the government has a lot of neat stuff out there that isn't money. So watch this video. It'll show you more about it. And your name is?
Muhammad Akhtar. I am the Director of the Department of Health and also member of the Exchange Board.
I see. Well, we're here to talk about how good this Exchange Board is going to be to the average person out there. It's terrific.
Exactly right.
And I don't start till for a year and a half.
Well, some things have already started, but
Really?
the whole thing will really
be there.
Will be there.
What will be available? Any kind of help on the exchanges earlier before that? January 14th?
I think right now there are some things that have gone into place already that are already implemented by the federal law. Nobody has to do anything.
Right.
You don't need an exchange to implement those things. For example, if you have a child at home who is less than 26 years of age, they could get on your insurance. So if your insurance company said no, you just pick up the phone and call the line, and they have to provide that. So that's already in place. Same is true of charging for preventive health services.
Oh.
For example, you want to have a mammogram done, or you want to have cholesterol checked. There's no fee for it. There's no co-payment.
Really?
There's no deductible. Every insurance.
So even right now,
now,
that's news to me.
I'm
in this business.
It's
so
right
now,
right.
when I feel, boy, I want to get my cholesterol checked or anything, and my insurance says, no, that's not covered. They can't do that, even in existing policies.
That's exactly right.
Wow.
That's exactly right. So you go to your doctor.
How many people know that?
So what people are missing in this basically right now is that they're not going to the doctor and taking advantage of it.
Oh, definitely.
Everybody should go to the doctors, and when they go to the doctor will do the examination.
Right.
He will determine, based upon your age and your sex, what kind of test you need for preventive services, whether you need cancer screening, or whether you need cholesterol screening, or whether you need...
So can you be that general in calling the doctor, hey, I just want to have...
Absolutely. I want a checkup.
I want to be checked up.
I want to be checked up.
So you could call your doctor right now, and all the insurance plans have to pay for it.
Exactly.
What the hell?
No question about that. I mean, that's the big advantage of this thing. That's the big advantage.
But I thought
of
that was later.
No. That's right now. Right now.
I mean, I heard about the kids, but I heard about
no, right now.
Wow.
Right now, that you could just go down and really get that. And can take the complaint too.
What are the things that you would tell your parents now to think about?
If my parents were living today, I would just say, you know what? Go and get yourself screened.
I see. Yeah.
And do it every year.
Right.
Go down and get yourself checked up. I would tell my parents all the vaccinations, whether it's flu, whether it's for pneumonia, it's free.
Right.
There's no co-payment.
So they can't even co-pay you.
No.
You're right. I just had a physical myself like this past week, and I don't think I had a copay.
And so you just there's no copay. So you just go ahead and say, this is what I need based upon your age and your sex, and you know they just provide you all the screening. If they had taken care of themselves early on, you know, we wouldn't be in this bad situation after, you know, certain number of years. My both parents had great medical difficulties, and their list of, you know, 15, 16 medication that we were always sort of trying to work our way through.
Every day.
Yeah.
It's funny how we manage now. Besides health, I mean, exercise every day because of that. But now I'm thinking, how do I exercise my mind? So what I decided to do, I'm taking Chinese.
But when we,
I mean, what's the hardest thing I could do with my mind?
But many people just sort of think that preventive services mean going down there and getting your blood pressure checked, your cholesterol checked.
It's more than that.
It's way more than that. Preventive services also include that if you are smoking, they provide you counseling.
Oh, I see.
It's paid for quitting smoking. If you have alcohol problem, you know, they help you with that.
Kidding?
If you have weight problem, there's help counseling for that. So it's really a very good deal for the people.
Gosh, I didn't really think about that. You know, mental and physical and smoking cessation. That's terrific.
And a lot of people just don't seek help because they don't know how much it's going to cost. The insurance company were not paying it in the past, and what might happen.
And then they'll sue you.
And all of those things. But no, not anymore. Not anymore.
It's just but not anymore with healthcare today. Today. Oh, that's terrific. Well, you're awfully nice you're here.
My pleasure. Thank you.
Listen, I've come find out about this health insurance stuff. You know, it's like almost 20% of our
Listen, it's up to you.
Right?
Now it's up to you to go take advantage of it. Go get yourself checked up. Get all your vaccines that you need, and make sure that you have you are up to date on everything.
Great.
Thank you very much.
Okay, you see that guy? He was a terrific fellow. But you see, I mean, find out about the program. Find out where that health exchange is going to be in your state. Because I mean, this is important stuff. I mean, this is a game changer. You know, this is going to save your life, save you a lot of money, and everything. Health is, you know, what could be more important? You know, so don't find out the baseball games first. Find out about that exchange, where it is, how you're going to use it, okay? And if you don't know how to do that, you know, call your elected official, or that 211 is a good place too. They'll be in every state eventually, and if your state doesn't have one, then there's a national one. So don't worry about it, okay? Your health is important.